Hi, I'm Daryl McIntyre. Welcome to this latest episode in our Stewardship Sessions, Raised with Care. Tonight we are going to be focusing on the dairy industry here in Alberta. Stewardship Sessions, if you've been watching them over the last several weeks, it's a series of interactive, live-streamed conversations talking with Alberta animal owners, livestock owners, talking about some of the animal health issues that producers can face, and then also some strategies to try to mitigate some of those health issues among their animals. So we'll be talking about prevention strategies, how having a good relationship with your veterinary team can make a huge impact. We'll talk about animal welfare overall, antimicrobial stewardship, and also your bottom line, because at the end of the day, you still need to protect that as well. So we have more coming in the upcoming weeks. We'll be featuring animals like sheep, goats, dogs, cats. We'll talk pork. We'll talk poultry. That'll be just in time for Thanksgiving, by the way. And you can watch any of the conversations that we've already done and then continue to do simply by going to raisedwithcare.ca and then simply follow the links. You'll be able to see some of the past episodes, and you can rewatch this one again if you would like. So if you are joining us in real time today, one of the really great things about being able to live stream this is to have your interaction with us. So if you have comments, feedback, questions that you want to throw as we have our conversation over the next little while, we'd love to hear from you. It lets us know you're there and that you're engaged and you want to have a good conversation with us. So if you're on any of the links, you can through YouTube, you can put on the little notification bell to find out about future sessions down the road. Leave a like or a comment through Facebook Live, and we'll keep you up to date on what else is going to be coming up down the road. So as I mentioned, we are talking about the dairy industry tonight. Here's a few facts for you. The fourth largest dairy dairy producing province in Canada. We have more than 515 dairy farms in our province. The dairy industry certainly does have some of the highest standards in the world for milk safety and quality. And part of that is because of the dairy farmers of Alberta themselves, who have actually been able to create a program that's called Pro Action. And that means that all dairy farms in the province are independently validated to produce safe milk, to achieve high animal care, practice biosecurity, meet traceability rules, and follow quality milk standards. It's very important in that business to be able to self-regulate a little bit and to also make sure that everybody's on the same page. So that's a very big deal. Let's see. I am not all that wired. We had a milk cow when I was a kid. That's a lot different than the full dairy industry. Somebody who's been involved and is working with a lot of dairy producers is Dr. Collin Lawrence, and he's our guest in this session tonight. So let me tell you a little bit about him. He's born and raised in Westlock, Alberta. He was influenced by his father, Jim, who's also a veterinarian. So that impact and that interest clearly hit home, and certainly did with the entire family. Actually, both of Collin's brothers also became veterinarians. This is a family affair. Apparently, they didn't want to branch out. They liked what Dad was doing, I suppose. Dr. Lawrence began his career with a small and large animal medicine, but now spends most of his time working with dairy and with beef herds. Married, 3 fantastic children, I understand, and spends lots of time in the great outdoors. So, like so many of us, enjoying the outdoors during this unusual time. At least we have a nice fall. Dr. Collin Lawrence, thank you so much for joining us. Appreciate it.
Thank you for inviting me.
So who's the best veterinarian in your family between your brothers and your father and you?
Oh, that's classified.
You didn't know that's classified.
Depends on perspective, I guess.
Are all of you in the same zone, or do you all have different specialties? I'm just curious.
So Dad now retired. He works at the same practice as myself, and my middle brother, he also works with me at practice. My youngest brother, he's gone to the dark side and works just with small animals, and he works in Langley, BC with his wife, who's also a vet.
Oh, very cool. Well, the conversations must be fascinating when the whole family gets together.
They can be quite diverse, but yes,
Well, hopefully tonight's conversation will also be fascinating. So once again, whether you're watching through YouTube Live or Facebook Live, we'd love to hear your comments and your feedback and any questions that we have as we go through. And perhaps some of our conversation will twig you on to something you want to talk about or you want to ask about. But why don't we get just with some basics? So clearly I'm not in the dairy industry. There are but the dairy industry, the people who are in it are pretty well versed in animal health. They have to be, because their businesses depend on it, right?
Right. They are well attuned to the health and welfare of their animals. They're in those barns 24/7. Many of them are second or third generations. They've grown up. They know cows, and they know when to identify a sick cow or a healthy cow, and when their cows are doing well and when they're doing well.
Yeah, and it's not a job. It's not even a lifestyle. It's a life.
It is. It's the family, it's the wife, it's the kids, it's the relatives. It's hard to get off the farm when those cows have the demands of keeping them healthy and they don't milk themselves.
Yeah, exactly. Wouldn't that be kind of cool if they actually could figure that out? It's almost getting to that point. So and I know the dairy producers, you are familiar with a lot of the health issues that are, but let's just run down a few of them that are most likely to be seen in a dairy operation. What kind of things are we dealing with on a regular basis? Yeah,
so I guess different systems that we run into issue, of course, mastitis. They are milking is their primary purpose for us. So we do see mastitis quite a bit. Other than that, lameness in our cattle, either both infectious or non-infectious causes of lameness. Gastrointestinal problems, things like displaced abomasums, acidosis, diarrhea, or just inappetence in general. And we also run into reproductive problems in them, whether that is truly infertility, retained placentas, metritis, and calving difficulties. Then getting into the calves, we run into mostly diarrhea and respiratory diseases.
Which you would see in the beef industry as well. That's just the nature of sometimes you've got to be able to deal with it.
Right. The diseases that affect a dairy cow affect a beef cow. It's just maybe the proportion of how much that you see in one group versus the other.
Yeah. So are there what are the strategies for dealing with things that are as common or potentially common as, say, mastitis? Does that, how do you deal with that, and how do you treat that on a regular basis?
Right. So monitoring wise, I mean, they're going to be fairly quick in picking up something like that. They have filters in their milking system, so they're going to know fairly quickly whether there is maybe a cow that has mastitis. So maybe they will know as they're prepping that cow for milking that she has mastitis. There is also on-farm diagnostics and testing that we'll get into later perhaps, but that might even pick up on mastitis before they even clinically see it. And from there, once they identify it, again, there's opportunities, on-farm diagnostics and stuff like that to decide which cow should be treated, which cow shouldn't be, and whether they will self-cure on their own and not need necessarily antibiotics or medications.
Well, and that's been a big part of this, talking about antimicrobial stewardship. So you still have to use them periodically, but especially in the dairy industry where a cow is delivering milk every single day, you really have to be careful about using it how often and when, because that milk basically gets thrown out.
That's right. So there's treating a cow immediately as a cost, whether the antibiotic input cost and the fact that she is going to be out of the tank and that milk is going to be dumped. That means a lack of revenue for that farmer, but not every case needs that, and many will self-cure on their own. Actually, their immune system is fantastic in that regards, but some of these cows, it's because they are chronic cows and the pathogen that they have is not going to be responsive to the type of antibiotics we have. You're wasting your time and money doing that. And so most farmers have got that figured out, that there's a right way of doing this.
Well, and as I learn a little bit more about the dairy industry, it's a lot different than the beef industry. There's a lot more hands-on. It's a lot more everyday. In the beef industry, you can, if there's the feedlot or if they're just out in the pasture, deal with a couple of things and you're pretty much done with them. But these cows are dealt with on a daily basis and treated on, or at least monitored on a daily basis, right?
Right. Yeah, they are being seen at least twice a day in the milking parlor, let alone when that producer is walking through the barn, maybe looking at other cows or watching for heats and things like that. They are going to observe these cows many times. And because it is more intensively managed, they're going to be there right in front of them all the time. And
well, it's because they're you can almost call them performance animals, right? As opposed to...
They are, that's right. A comparison of them, a dairy cow, I would say, is more like a Formula One car versus a beef cow, maybe more like a pickup truck. They're both vehicles. They both have the same components, but they don't operate the same. Yeah. And as such, a high-performing animal like that needs a little more maintenance and monitoring for sure.
Yeah. Are there any specific diseases that maybe are commonly mistreated or misdealt with? And again, we come back to most of your dairy producers are very good at keeping on top of this stuff, but there must be some areas that you kind of go, well, we should probably be going in a different direction.
Yeah, that depends, I guess, on the farm and what kind of disease issues they may have. Things that maybe we run into, treating some of these cows that are chronic mastitis cows, maybe you should stop treating them or trying a different antibiotic, because if they haven't responded the first or second time,
they're not going to.
They are, for lack of a better term, they're a lost cause. Yeah. And so we got to decide what we're going to deal with this cow instead.
Because it's not helpful to just keep pounding the antibiotics at it if they're not doing any good, and it's just going to continue to reduce the effectiveness of that.
That's right. That's right. So you've done nothing but keep this cow out of the tank and treat her with an antibiotic, and that's not necessary. And so that's definitely evolved quite a bit in the last number of years with the prudent use of antibiotics, of when it's necessary, when it's not.
So alternatives then, in some of the other areas that we've covered, we've talked about vaccines. So you prevent the problem in the first place, but how many of these sort of not unusual health issues can you actually use a vaccine on?
Yeah, a lot of them really turn into management, probably more than anything. Even when a vaccine is used, it's not your security blanket necessarily, and it is very specific to the pathogen. If we go back to mastitis, there's only a few of the pathogens we can vaccinate against, but how those pathogens are spread, they're often done the same way. So even if a vaccine prevents this pathogen, well, the 8 other pathogens all got infected the same way, and there's just no vaccine for that. As well,
sorry, just on that point, does it depend on where you are too? Are some of these pathogens specific to an area, or you might see an outbreak in one area and be able to identify it, or? Yeah,
that is very true. We probably, as regional on through Canada, I'd say, we probably see more, maybe we see more coliforms maybe here versus, say, Klebsiella and things like that. We might see more in BC and stuff like that because of using wood shavings more for that, as well as respiratory disease. They might see more pneumonia in their lactating cows in maybe Ontario and BC and stuff than we actually see here. And that's because of the environment more than anything.
I'm just curious on this ProAction program. How much input do veterinarians have on that? That was an industry created program, right? But veterinarians must have had some input in there as well, or at least been asked about it.
Right. Again, it was definitely way above my pay grade and my I guess level of expertise on the creation of this program. Yeah. But there are certain components of it that the vets are significantly involved in, and including like the biosecurity module and stuff, and creation of protocols. So yes, there was vet input on how do we create these modules to actually make them effective and implementable, versus being just creating something that's a pie in the sky, and it really is a detriment to the industry versus a benefit. So there was some input, but otherwise this was very much an industry driven prerogative.
Well, I'm curious about with some of the health issues, when we talk about the management of them, etc., how different things are today as opposed to, say, 10, 20 years ago. There's obviously been a lot of technological change, right?
Yes. Yeah. How much has changed in my relatively short 15 years of the technology and what producers are able to monitor on their animals, and what's available on farm and on their smartphones. It's just amazing on what they have, and I guess I can get into details now or later, but
do it now. We're on a roll.
Okay, I mean, the technology that's there's inline monitoring of in some of these farms where we can see if these animals are in heat, if they're pregnant, if they're suffering from ketosis, even they're indicators of mastitis even before we actually see clinical disease of mastitis. We have monitors of neck or on the ear that show if they're ruminating properly, if they're eating as much as they did yesterday. All these things that allow a producer to pick up on potentially a disease and allow them to make, I guess, I guess, preventative actions before it becomes something that has to be treated, and where we have to then get invasive and use medications.
Well, and then we also talked a little bit, I mentioned at the beginning of it, it's also about bottom line too. So as a veterinarian dealing with a lot of dairy, you're probably out there a lot because it's a much more hands-on, it's a much more active engagement. But at the same time, if you already have an appointment scheduled for next week, really, if some of the farmers can deal with some of the stuff on their own without having to get you out again, and they have diagnostic tools that allow them to figure that out, and they can probably just talk to you on the phone and figure out what the next course is.
Absolutely. Right? And you know, because we know what we're looking for and we have these tools to pick up on these things, that's where we can establish protocols. And, you know, if you see this and this, these are the actions you can take, and you don't necessarily have to wait for me to get back to you or, you know, phone you later in the day or whatever. You know how to treat this animal before we have to make any more invasive procedures to them. So
I think it's probably fair to say that most of the dairy operations, let's say 517 in all of the province, so there's really not that many, all would have a health protocol in place, would they not?
I would think to some extent or another, they would. And because of this pro-action, there's really a requirement for them to have kind of a baseline protocols set up on more of the common things of when you're dealing with painful procedures in calves and treatment of the common diseases, that we have protocols set up so that errors aren't made, and that we follow these guidelines that are designed by your herd veterinarian. We can get on these things faster. Yeah.
I'm curious what kind of questions you get on a regular basis. And by the way, along that line, if you have anything you want to comment or feedback or ask some questions, dive in. Now's a great time to do it. But what kind of questions are you getting? Because I don't want to keep pumping all your tires too high, but the producers know their stuff pretty well.
Right. Yeah. They know how to treat all the basic stuff, mastitis or a foot infection or a uterine infection. We've taught them how to deal with those and identify them. So our questions are kind of get more into preventative stuff and management stuff. This is my problem. I'm treating more mastitises. Why is this the case? Or, I got more lame cows, and, my foot trimmer says I'm getting more abscesses or more sole bruising. Well, where is this coming from, or what are we doing wrong? My fertility, I should be getting more cows pregnant. Why is this occurring? Well, now we got to get into the weeds and see, is this a veterinary problem? Is this maybe a nutritional thing? Is this a barn management thing? Or is it an employee problem? All those things that it can get pretty expansive pretty quickly, but it is often more on management and again, I keep saying the word preventative, but it really is, versus the treatment part. We've got that figured out. That's the easy part.
But if you can not have to treat in the first place and you can prevent it from ever happening, it's infinitely less expensive. It's a lot easier on the animals. It's a lot easier on the producers, and it's a lot easier even on the veterinarians, because you can work on some other things, right?
Absolutely. If the days where there's nothing to do as far as treating an animal, the more of those you got, the better life's going. Your cows are healthier. You've got more free time to spend with your family. The cows are milking better. So your bottom line's better. And if I've got a happy producer, then my life's almost a lot easier too that way.
So if you were going on a dairy farm for your first time, what are you looking for? Things that are preventable, things that add to that prevention strategy. What are you going to look for?
Right. Well, we're going to hopefully have a good walk around and see every age group. We're going to discuss, how these animals are fed, who's feeding them, how much they're getting fed, how the producer feels they're doing. Do they see, is there, I'm really happy with my calves, but it's my young stock that's not growing very well, or it's taking longer for them to get pregnant, or my cows, during the dry off period, I run into too many problems when they freshen and stuff like that. So it can be an all encompassing, it can take a number of hours to really achieve even just an overview of how the farm is operating, because it is so intensive and there are so many factors to that before we even get into talking about protocols and vaccine strategies and just a vet-client relationship and prescribing medications. Before we even get there, we've got to kind of establish what's the baseline on the farm and where do we want to go? Is the baseline all we want to do, or do we want to step it up? And
So I'm also curious on a few of the, so mastitis, for example, what's causing it? What is the standard, the most common cause for mastitis? And, are there different things that will sort of spark it?
Yeah, there is some regional variation to that. There's, our most common ones, I'm probably not going to remember them all, but Staph aureus is a big one. Every dairy farmer and vet's going to know that one. Strep uberis is another one. We're going to get into some other ones, and those are contagious ones. Those are ones that are going to transfer from cow to cow, usually during the milking process, versus there are other pathogens that are actually caused or picked up in the environment, like E. coli and Klebsiella. And so they will present totally different, or usually totally different in how they affect the cow and her udder, and they are managed completely different. And where is your weakness? If you have, and that's where diagnostics really help out on, if you've got a lot of E. coli problems on your farm, well, we can talk vaccine, but we can also talk, why are they getting E. coli and where are they getting it from? Because those require different, I guess, strategies than if you've got a contagious mastitis. So
you mentioned diagnostics. A lot of the producers have quite a plethora now of diagnostic tools that they can actually access themselves and then talk to you after. Right?
That's right. Yeah. There's been massive changes since my started my career and what they have for tools. Yeah. So on-farm diagnostics, like on-farm culturing and things like that. And we talked about these inline milk things, milk testing and stuff. Yeah. It really changes how they can operate.
Well, and then he's more informed, and then it gives you a better idea before you ever come out.
Right. They kind of got the answers before I have to ask the questions. Look, I've got 6 of these strep uberis in the last little bit. Yeah. What do we got to do? So we don't have to go through all those questions. We can answer that in 5 minutes or about that of, okay, we need to do this different. Mm-hmm. And maybe our antibiotics, you're using the wrong choice of antibiotics and stuff like that.
Let's talk about biosecurity for a little bit, because a dairy farm is a different animal, as it were, right? It tends to be a consolidation. Animals are a little closer together, indoor barns, where you're not seeing that in the beef industry, that kind of thing. So biosecurity has to be vital, I would think, right? And plus, you're having, like the dry cows or whatever, you would have to really focus on that.
Right. It is a very much intensive operation. And so the opportunity for pathogens to spread on the farm are very easy, because there's usually only a number of employees that can spread pathogens in the farm. So there's actually a number of levels we can talk on biosecurity. And one is on farm, we're trying to avoid diseases that probably older animals have from transferring down to younger animals. Yeah. That's usually how the sources will often go. But there's also transfer amongst their own cohort. So we could talk calf diarrhea is a very common one to deal with. And so it spreads very easy amongst the calves, between each calves. But there's also that risk of certain diseases transferring down from mom, either if they have the opportunity to nurse from them, or also just from across fence. And from a manure management wise, we have to be cognizant of having clean coveralls and clean boots, and farmers, producers understanding they are very much a source of disease transfer. Next up on that is so that's in farm biosecurity measures we have to establish, and that's in pro-action. Then it is external sources. So that's me as number one, as I go to all of these farms. Yeah, so I got to be clean when I show up, and I should be clean when I leave. Yeah. But then there's the nutritionist, and there's the feed salesman, and maybe the salesman for tractors and stuff like that. So they have to be aware of these guys potentially could bring in a disease as well.
But because I think it was a little while ago, but the idea was, let's go to a dairy. I want to see the dairy operation. Oh, we'd prefer you not to be in the barn, right, or anywhere near it. Yeah. And then they explained it. It's just that we need to protect them. So biosecurity. A lot of people don't do tours anymore, for example, or are very picky about how close those tours get to some of the operation. Just explain the idea and the rationale behind that.
Right. So it's a two-way street. One, of course, is there a lot of diseases that urban people are going to transfer into a farm. Maybe not necessarily, but if it's a farm tour, that's different. If they've gone to 2 or 3 other farms, a farm's going to want some measures in place of, you're going to wear booties or some coveralls, or how close you're going to be able to interact with those animals. Plus, they're actually going to be also just as worried of disease transferring from the farm to those people, that we call them zoonoses. And a calf with scours, some of those scour causes can come to you. So we don't necessarily want you out there having those calves suck on your fingers or poop on your boots, because you can bring those back to you. So we have to be aware of that, but we also don't want to create a locked door, locked gate mentality, because the optics of that says we're hiding something. And
it's not hiding, it's protecting. It's
protecting. So there's a reason for that it is the welfare of these animals that we're concerned about. But at the same time, under the right circumstances, there's no reason why the public shouldn't be able to walk into any barn and be quite happy with what they see. Those animals are happy and content, and I would never be afraid to show anyone any of my producers' barns.
Well, and that's the other thing. All of this stuff is designed, if you want to look at it for an economic reason. A happy cow is going to produce a lot of milk.
That's right.
An unhappy cow, a cow that's in pain, a cow that's having to deal with health issues, is not going to produce.
No, that's right.
So that's the bottom line. At the end of the day, if you have a happy cow, life is good.
Right. And so you have to decide, where are your risk factors in this? What are your causative agents? And so biosecurity is part of that. You're utilizing of vaccines and management of your animals. All of these things play into, making sure that if your cows are happy, they're going to put food on your plate, but also money in your bank account. Yeah.
That almost sounded like a slogan.
Yeah.
In a little way, didn't it?
Yeah.
At the same time. Yeah. What's one thing you would like to see happen within the dairy industry right now? Like, it sounds like a lot of things are just going all in the right direction, and that everybody seems to be on the same page for the most part, especially on the antimicrobial stewardship. In fact, it probably was long before a lot of the other different animal industries were involved. But would you agree with that first off? And then where would you like to see us go down the road?
It definitely, I think they are showing a lot of leadership and can demonstrate how things can be done well for some of the other industries. And I will admit I'm naive to what the poultry and swine and others are doing. But they are doing things, I think, very well. Can we make improvements? Yes, but that's where we have a lot of, I guess, discussion about that. One of the big things is welfare. We talk welfare, and so lameness is a big one that we talk about a lot. Whether it is, again, infectious causes or non-infectious causes, the management of that, because we realize these animals are uncomfortable. And if they're not moving around properly, then they're not getting up to eat. They're not getting up to milk if they have a robot farm, and they're not healthy animals. But also, it's just the fact that they are sore and in pain. And we want to make sure, because we are utilizing them for what they produce, we have a responsibility to make sure that they are in their utmost health. Yeah. We don't feel that same compassion. You see so-and-so limping down the road, down the street. Well, he injured his leg football. Well, I don't really feel sorry for him. But this cow, I do feel sorry for.
You're stewards for their health too.
You have to be watching out for them. So so that we are definitely very much on the right track. But the line in the sand is always moving. There's always room for improvement, and it's just good that the conversation's always there. And so, Pro Action was there was different modules. And so we started at the basics. It gets a little more complicated as it goes along, but we're nearing completion of these modules. And from there, it's just going to be, I think, an improvement on each of these aspects that they're watching about so much. So to answer your question, is there an area that is weak right now? No. Are there little things that it'd be always nice to think all of us vets would like to see better on some of these farms? That's more an individual management thing of things like a cow that is lame, that, deal with her versus waiting for the trimmer to come. He's coming in a week or two. Well, he'll deal with her then. No, deal with her now. The biosecurity things, we get into that. But, wear our gloves, our hands are a major pathogen source. So wearing gloves at milking time is probably one of your biggest things to reduce contagious mastitis. But wearing gloves when you handle your calves, that's, again, both feeding them and treating them, spreading pathogens that way. That wearing just simple latex gloves is a big way of eliminating that or reducing it.
I'm curious about how much you end up doing work through telemedicine, either over the phone, that kind of thing. How much of that clearly would have changed in the last little while, or has it not? Because there's always been a phone you could always call. Yeah,
as far as a large animal vet, I'd say probably most practice could say they spend a significant amount of their day on the phone, either in their office or in the vehicle as you're traveling between farms. The telemedicine has always been there. I think some of the regulations that we face as an industry has us a little more accountable to what we have to do or can prescribe over the phone wise, but the discussions with the farmers has always been there. And actually, I don't think COVID for us has changed any of that, because they have an open line and open access to us. And so when there's an issue, there really is never any hesitation to give us a call.
So, and again, a lot of it relies on the producer. So things like bacteria and sensitivity testing.
For the sensitivity, like individual pathogens are looking for sensitivity. That's probably more onus on us if we're looking for, they're using this antibiotic and it's showing it's not responding. He's treated a number of these animals. That's where then we would probably send that to a diagnostic lab to see if there's resistance in this pathogen, and if it is the same pathogen in all of these animals, that's probably where we would get involved, versus what they have for on-farm diagnostics isn't at that level.
We've talked about, because there's different antibiotics that are available as tools or bullets at the gun, or however you want to put it. And with some areas, you've seen the usefulness, the ability of that antibiotic to do a good job reduced a little bit because it's been overused. What is the level of efficiency or effectiveness in most of the antibiotics that you would use on the cattle? Like, have we lost some efficacy with any of them, or are we doing fairly well?
Yeah, I'd say anecdotally within our practice, I don't think any of us could speak to seeing a significant change, or, oh my gosh, there's definitely, this drug is not working like it used to. But we do see on-farm variations that this medication is showing resistance, that we were treating pneumonia for the last 10 years with this drug and now it's not working. We do have to change that, which happens. That's selective pressure. That is natural selection. We've done that. But as an industry wide, when you kind of increase the scope of it, yes, there's data that is showing that there's a general trend of ongoing resistance. Could I say it within our practice and our farms, there's a crisis going on? No, not yet. Yeah,
and there will be new generations and next generations, I imagine, but the longer we can preserve the ones that are in place now, the better off we will be.
That's right. And because of this One Health and the knowledge of needing to keep antibiotics, of high priority antibiotics, in the human world and not in the animal world, I think we're actually probably going to see some new antibiotics over my lifetime, but not probably a lot of changes, as much as we would want to see, because the new toy is always fun to play with and has, it's going to work on everything, and before you start seeing resistance. But for the most part, those medications that maybe aren't of high importance, still in general, I think are working quite well.
That's good. That's nice to hear.
Yeah.
So that message has been getting out. So that's a good thing to know.
Yeah.
I'm going to give you an opportunity where we're going past the half-hour mark, which is usually where I start looking at wrapping things up. So if you do have a comment or some feedback or a question that you want to throw at Dr. Lawrence, now is your opportunity, because we'll wrap things up pretty quickly here. I just want to give you a heads up about what's coming up next week. Actually, our next session is one that we have already done before. So we are going to have the beef producers on once again, just revisiting that conversation I had with doctors Pat Burge and Roy Lewis from earlier this year. It will be a rebroadcast at that time, so we won't be able to take any live comments or feedback during that, but well worth taking a look at. And then the next interactive feature is just in time for Thanksgiving. We'll be talking poultry. So yes, of course, including turkeys. That's Thursday, October the 8th at 7 o'clock in the evening. That one is in a couple of weeks away. So we did have a comment coming in. Oh yeah, the family milk. So I was explaining to some friends earlier that this was going to be interesting because when I was growing up, we had a milk cow. Yeah. We had an old Jersey and we would milk her, and then we consumed all of those goods. Yeah. Do you see any issue with that, and how much? What are the drawbacks or the potential pitfalls to having that if you're not as connected with a veterinarian or with those health protocols as say some of the larger dairy producers?
Yeah, so the family milk cow, there's nothing wrong with still having that family milk cow. We know there's potential pathogens that can spread from a cow to us through the milk. So you have to be kind of cognizant of that. Probably one of the bigger ones we would discuss is called Yonis. So that's called MAP, or Mycobacterium avian subspecies paratuberculosis.
Okay.
That's why it's the acronym MAP.
Good call.
So it is sometimes found in people with Crohn's disease and inflammatory bowel disease. And is there a correlation? Are we getting it from cows, or is it endemic in the human population? That I will not get into that. That could be a long conversation, and definitely above my intelligence level on all of that. But it is something that we would be cognizant of where did this cow come from? Maybe we would consider testing this cow if you want to keep her on your farm for a long time. There are relatively simple and cheap tests to test for this. Other things, that could be spread in the milk. Usually I don't lose a lot of sleep over that. Yeah. So for the average milk cow, I think it's fantastic. There's nothing wrong with it. I grew up
on it and I'm still here.
Yeah, so it is unpasteurized milk, so that's the risk you have. But if she's healthy and she doesn't have mastitis, then I don't see any reason why she couldn't be your pet and your food source.
And also, I would think there's a hygiene issue as well. So making sure that everything is clean around while you're milking, etc., and just trying to keep those things locked down. Right.
Right. That I think if a lot of the contaminants that probably would make you sick by drinking raw milk probably actually aren't coming from the milk themselves. They're probably environmental contaminants. We call fecal contamination. Probably would be the most common one. If she poops, she gets something on her tail and she smacks it against the udder. And if you're not careful, that's going to end up in milk. And if it sits in your fridge for 2 or 3 days, you've got a little bit of a milk culture there of a pathogen you don't want. So hygiene, I think would be probably your biggest factor in limiting your risk.
Perfect. There you go. From large-scale dairy operations to the family cow. Yeah. Pretty much able to cover it all. Yeah. Dr. Lawrence, thank you so much. It's been fun talking to you about the dairy industry.
I appreciate it very much. Thank you for having me.
You bet. Thank you. Appreciate it. And thank you for joining us with our Raised with Care Stewardship Session. Once again, a rebroadcast of the Beef Producers one for next week, and then we'll be back with a live interactive session just around Thanksgiving, talking poultry on Thursday, October the 8th, once again at 7 p.m. So thank you again so much for watching, and we'll see you again in a couple of weeks.